Welcome to the Cenario Podcast, your guide to mental health and well-being. Each episode, we uncover practical tools, discuss expert insights, and explore how supplements can transform your mental health journey. Get ready to learn, grow, and thrive with us.
Welcome back to the Deep Dive. Today, we're tackling a really important topic, one that's often misunderstood: bulimia nervosa. Our goal here is pretty straightforward: to give you a clear, quick, but deep understanding of this condition. You know, what drives it, its real impact, and crucially, the path to recovery. Because recovery is possible.
Absolutely, and it's vital we talk about this. Bulimia nervosa is serious, it's common, and, well, it's often hidden. We're talking about this really dangerous cycle, right? Binge eating, first consuming a huge amount of food quickly, and then immediately after, behaviors aimed at sort of undoing that, purging. That could be vomiting, laxatives, or even like extreme exercise.
And the sources we looked at really hammer home the severity. This isn't trivial. It can be life-threatening.
Yeah.
What's really tricky, though, and you mentioned this hidden aspect, is that someone might look, well, normal weight-wise. That appearance, it kind of masks the struggle, doesn't it? It makes it easier to keep secret because of all the shame and guilt involved.
Exactly. The outward appearance can be completely misleading. The internal damage, though, that's happening regardless of weight.
Okay, so let's get into the nuts and bolts, the clinical definition. What are the key things, say, according to diagnostic criteria like the DSM-5, that define this cycle?
Right, so there are three main pieces. The first two really define the binge part. One is eating a lot more food than most people would in a similar time frame, usually within about 2 hours. It's got to be significantly large. And two, maybe even more important, is the feeling during the binge, that sense of being totally out of control, like you just can't stop.
Okay, so it's not just eating a lot, it's that feeling, that powerlessness that's key.
Precisely. That loss of control is often followed almost instantly by this wave of intense fear about gaining weight, plus overwhelming shame and guilt. And that feeling, that emotional recoil, leads directly to the third part.
Which is the compensatory behavior, the attempt to undo it all.
Exactly. The purging, fasting, excessive exercise, whatever it is they do regularly to try and counteract the binge. That regularity is key for the diagnosis. It's fascinating, really. The psychological distress about weight gain seems to override almost everything, driving these desperate, often harmful actions. If those compensatory behaviors aren't happening regularly, we're actually looking at a different diagnosis. We can touch on that later.
Okay, that distinction is important. Let's move on to symptoms then. If weight isn't a reliable indicator, what are the warning signs? How can you tell if someone might be struggling?
Well, you need to look for changes in behavior and attitude. Often there's this intense preoccupation, almost an obsession, with body shape and weight. It can seem really disproportionate. You might also notice big mood swings or signs of anxiety or depression, especially right after meals. Intense guilt around eating is a big one.
And what about specific habits? I've read about things like eating really fast, maybe hiding food, or making frequent trips to the bathroom right after eating. Being kind of secretive about it.
Yes, definitely. Those bathroom trips, especially if they become a pattern right after meals, can be a significant clue. The secrecy stems from the shame, But it's crucial to remember these behaviors aren't just quirks. They're symptoms of a deep internal struggle, and that struggle is causing real physical harm. That's the so what here. The body pays a heavy price no matter what the scale says.
Right. Let's focus on that physical toll because it sounds severe. If someone is purging regularly, what are the major health consequences we need to be aware of?
The list is pretty grim, honestly. Constant purging, whether vomiting or using laxatives, leads to major fluid loss and throws electrolytes like potassium, sodium way out of balance. That dehydration and electrolyte imbalance is incredibly dangerous for the heart. It can cause arrhythmias, irregular heartbeats, which can actually be fatal.
Wait, so the heart risk isn't just a long-term thing, it can be immediate.
It absolutely can be. Severe electrolyte shifts can destabilize the heart very quickly. Beyond the heart, there's damage throughout the digestive system. Think chronic stomach pain, ulcers, even tearing in the esophagus from repeated vomiting.
Ouch. And are there any physical signs that might be visible, even if weight seems stable?
Yes, some are quite specific. The stomach acid from frequent vomiting is incredibly corrosive, so you often see significant tooth decay, enamel erosion. It's a very distinct kind of damage. Another visible sign can be swollen cheeks or jawline, sometimes called chipmunk cheeks. That's from the salivary glands swelling up due to the trauma of vomiting. These can be really telling signs for clinicians. And we should also mention the broader physiological impact. Hormonal imbalances are common, leading to irregular periods in women, which can affect fertility and bone health down the line. It really affects the whole system.
Wow. It really underscores that this is a serious medical issue, not just about willpower or habits. Okay, let's talk about who's at risk. Does it affect everyone equally?
Well, it can affect anyone, regardless of age, gender, background, but certain factors do increase vulnerability. Genetics seems to play a part. Having family members with eating disorders or maybe depression puts you at high risk. Another major one is dieting early in life. Starting restrictive eating when you're young seems to be a significant predictor.
And what about external factors, like pressure?
Huge factor. Pressure to have a certain body type, whether from society, specific sport, sometimes even family. That's massive. Then there are personality traits, things like perfectionism, being in high-stress situations often, or having a history of trauma or bullying. These seem to correlate.
That perfectionism link is interesting. Why might that trait, or being under high stress, lead specifically to bulimia? What's the connection there?
That's a really insightful question. Often, eating disorders develop out of a need for control, right? So if you're a perfectionist or you're in a situation that feels completely out of your control, work, relationships, past trauma-controlling food intake, and body weight can feel like the one area you can manage. The terrible irony is that the binge-purge cycle, which seems like it offers control, actually does the opposite. It traps you in this destructive loop of secrecy and shame.
That makes a lot of sense. An illusion of control that becomes its own prison. Okay, before we get to treatment, you mentioned clarifying the difference with binge eating disorder. Can you quickly explain that?
Yes, it's a common point of confusion, but a really important distinction. Both involve eating large amounts of food and feeling out of control during the binge. That part's similar. The key difference is what happens after. With bulimia nervosa, there are regular compensatory behaviors, the purging, excessive exercise, fasting, etc. With binge eating disorder, or BED, those compensatory behaviors are not regularly present. The distress usually centers on the binge itself and its aftermath, but without the systematic attempts to undo it.
Got it. So bulimia is defined by that consistent harmful attempt to compensate for the calories consumed.
Exactly. That drive to compensate, usually fueled by that intense fear of weight gain, makes bulimia destructive in a specific physical way that BE typically isn't, although BED certainly has its own serious health risks, often related to weight gain and nutrition.
That clarity is really helpful. Okay, let's shift to recovery. The good news from our sources is that long-term recovery is definitely achievable. But it sounds like it takes a dedicated, multifaceted approach. Let's break down the main pillars of treatment.
Right. Recovery usually starts with specialized therapy. Talking therapies are fundamental. Cognitive behavioral therapy, CBT, comes up again and again as being particularly effective for bulimia. It's really designed to tackle the specific thoughts and beliefs that fuel the whole cycle.
How does CBT actually do that? What does it look like?
Well, CBT helps you identify those rigid, often automatic negative thoughts like, I ate one biscuit, now I failed completely, I have to purge. It teaches you to challenge and restructure those core beliefs about food, your body, your self-worth. The goal is to break that link between the trigger thought, the shame, and the urge to compensate. Other therapies are useful too, of course. DBT, dialectical behavior therapy, is great for emotional regulation skills. Interpersonal therapy looks at relationship patterns that might be contributing.
That makes sense for the psychological side. What about the relationship with food itself? That needs healing too, right? That's where nutritional counseling comes in.
Absolutely critical. The binge-purge cycle completely scrambles the body's natural hunger and fullness cues. People often lose touch with what their body actually needs. A registered dietitian specializing in eating disorders doesn't just hand out meal plans, it's about re-education, helping the person understand nutrition, rebuild trust with food, and learn to listen to their body again.
So it's about getting back to regular, predictable eating patterns. It sounds simple, but I imagine it's incredibly hard work.
It's revolutionary, actually. Eating regularly helps prevent that extreme physical hunger that often triggers a binge. The main aim is to break the cycle, eat without that overwhelming fear and guilt that previously demanded compensation, learning to nourish yourself safely and adequately.
Okay, therapy for the mind, nutrition for the body's relationship with food. What about the direct physical damage? That's the third pillar. Medical treatment.
Yes. This is non-negotiable given the risks we talked about, especially to the heart and digestive system. A medical team monitors physical health closely. Often, medications are part of the plan. Specific types of antidepressants can be really helpful, not just for coexisting depression or anxiety, which are very common, but they can also help reduce the frequency of binging and purging itself.
And presumably, there's ongoing monitoring. checking heart function, digestion, teeth.
Constantly. Regular checkups are vital.
Well,
And sometimes if things are particularly severe, like dangerous dehydration, electrolyte levels are way off, or there are other immediate medical crises, hospitalization might be needed for stabilization. Safety first.
right. And the final piece, which seems crucial for long-term success, is support. Community.
It's so important. Bulimia thrives in secrecy and isolation. Support groups, whether they're in person or online, offer a space where people can connect with others who genuinely get it. There's no judgment, just shared experience. Breaking that isolation, reducing the shame, it's incredibly powerful for maintaining motivation and preventing relapse. Feeling understood makes a huge difference. So, pulling it all together. Bulimia nervosa is a serious mental health condition. It's this cycle of binging and compensating, and it takes a heavy toll physically and emotionally, even if someone looks okay on the outside. The risks are significant, but recovery is absolutely possible with the right help therapy, nutritional support, medical care, and community connection. Getting help early and sticking with it really does change outcomes.
Okay, so here's something to really think about for you listening. We talked about how things like perfectionism or being in really high-stress environments can increase the risk, how it can be this attempt to grab control when everything else feels chaotic. So what does that mean for you? Maybe take a moment to consider your own ways of coping with stress or pressure. How do those strategies affect your overall health, both physical and mental? Whether you're dealing with this yourself or supporting someone who is, remember this, finding true control and healing really starts with compassion for yourself or for them, and recognizing that recovery involves healing both the body and the mind. Early help and ongoing support are key.
Thanks for tuning in to the Cenario podcast. Don't forget to visit Cenario.com for more expert tips, articles, and supplements designed to support your mental health. If you enjoyed this episode, remember to subscribe and share it with a friend. Until next time, take care of yourself.